and welcome to my community on Afrocentric Television, channel 15.8. This is a station that revolves around the African community in the diaspora, especially here in Houston and by extension the United States. My name is Kola. You are welcome to the show. And today we have two guests that I'll be bringing to the show today. Three for two events, right? One is going to be talking about the women's health, and the other, of course, is going to be about a fair that is happening here in Houston that has to do with your life, living it well, by a church. I think that's the unique stuff. But before then, please do enjoy our editions and this episode with Bayonle for the soccer, and of course our girl Fauzi Aminu with the entertainment. Stay tuned.
Welcome back to your entertainment report with your favorite chocolate drop, Fauzi Aminu, here on My Community on Afrocentric TV channel 15.8. And I am back to deliver the tea, tell you where you need to be, and give you all the latest and hottest jams in the streets, because you know I'm the plug. This week, let me tell you guys how Tristan Thompson, Khloe Kardashian's baby daddy, is back with his first baby mama, Jordy Craig. You know, the one he was dating when he cheated with Khloe Kardashian, proceeded to get her pregnant, date her, cheat on her, and dump her. Yeah, that Jordy. Tristan is obviously the real city boy. Big ups to him, because, yeah, I don't know. Jordan was obviously right when she said she don't want none of that situation. Beyonce is definitely life goals, because after starring as Nala in The Lion King, she is now having conversations with Disney about having another movie, and that's lit, because her deal on The Lion King is the biggest one Disney has struck so far. So shout out to Beyonce just always being with the boss moves. That's my Virgo sister. Now, last week, I was telling you guys about how Chris Brown and Davido's new song is coming out, and just like I expected, it was mad. Chris Brown did not come to play games. He executed very well, and the video was fire. I am so excited. The video dropped almost as soon as the song came out. It was so worth it. Glad we did not have to wait. I saw some faces I recognized in there. I see you, Sarah. Come through, Anthony. The video was shot mad. It had over 1 million views on YouTube within a few hours of dropping. And if you haven't already seen it, you live in a cave and you just hate to see it. Y'all already know I'm going to talk about Burna Boy's new album, and I'm not going to give it a full breakdown, but just know I was not disappointed. I kind of expected a little more in some aspects, but that's a conversation for another day. I did feel like a lot of the fire songs had already been dropped as singles when I initially listened to it. But giving it a few more listens, I guess my ears kind of just like opened up to some other jams on there. And some of my favorite songs on the album that were not already dropped as singles were Gumbody, Omo, and Collateral Damage. Burna Boy had some international collaborations in there, like the ones with Angelique Kidjo, Future, Damian Marley, and YG. Either way, work was done, and I ain't mad at it. Speaking of Burna Boy, he's going on tour to a few cities in the United States like Los Angeles, Chicago, Atlanta, and of course Houston. So stay tuned so I can keep you guys posted and give you all the updates. Don't forget, for any information on any events, make sure you visit fauziaminus.com/events. The top 3 songs I have for you guys this week are Non-Stop by Terry. Terry has just refused to chill. First it was Same You, and now it's Non-Stop. And TBH, I'm here for it. I love it when people winning. Next up, I'm going to bring it home real quick. I have Love by Galactic and Oloye. If you haven't already heard it, what are you waiting on? Last but not least, and definitely not my least favorite, is the Body Deep remix by Wavy the Creator and Tiwa Savage. I was really nervous to hear what this was going to sound like, but I was not disappointed at all. They did what they had to do, man. And you know me, I just love Tiwa Savage. So yeah, Wavy Tiwa together, I love it. You can listen to any of these songs and the ones from the previous weeks on fauziaminus.com/top 3. That's all I have for you guys this week. I know you guys are going to miss me because, you know, my gist is always sweet, it's always hot, and it's always fresh. But please come back next week. I'll give you some more tea. Once again, my name is Fauzi Aminu, and this is the Entertainment Report on My Community. See you guys next week. Same place, same time.
Welcome back to my community on Afrocentric Television, channel 15.8. My name is Kola. As you all know, we bring about, the African diaspora events and culture, and we promote all that concerns us in the United States. And today we're going to be talking to two of our young pastors. You won't believe how good looking these pastors are when you start seeing them, and that's the reason, because they do life well. Right? So they are the pastors of Alpha and Omega International Ministry of Faith. So that's Alpha and Omega IMF. Joining us today is Pastor Raymond. You see, I told you I'm going to pronounce it very well. And Pastor Benny. Welcome to the show.
Thank you.
Please tell us, at first I was confused. Is it do live well? People need to live well, or do life well?
Essentially, it's do life well. We want you to live well.
Live life well.
Live life well. But we also want you to do life well. In the Christian community, there's this phrase that says, do life. We want to do life with each other. This new thing. Do life. We want to do life together and all these things. But essentially, you can't just do life anyhow. We want to do life
it well.
So especially in our community, there's a desire to afford health and, security and, information that we all need to do this life well. So that's what this fair is about.
So you have a fair coming up, yes. The Do Life Well Fair, correct? Now, and I heard that significant to a Bible verse in Jeremiah 33:6. Can you tell us what the significance is with that?
Yeah, essentially, the verse is saying that God wants to bring us healing and health, and wants us to live in abundance and security. But in order to do all these things, God works through people. He works through us. So we're praying that God can use us in our community to be able to bring this, the information, the venues, the ability to be able to live.
I love this already. Well. You have to bless us before you leave here today, pastors. So with this fair coming up, what do we hope to achieve?
Well, we have all sorts of information. We have all sorts of things that are happening. We have guests that are coming in. They're bringing free supplements and things like that to be able to help you in your healthy living. We have lawyers and things like people like that to come in and give us legal consultation. Free consultation.
Oh, wow.
Legal advice and everything like that.
You do want us to live well.
Of course. There's all kinds of things.
So from massages to diets to everything. Health screening,
to dance classes, to workout classes, financial classes,
y'all look good. That explains why. So, but since this is a fair coming up, who can attend? Is it limited to a certain age group or a certain demography, or
everybody? Everybody is welcome.
Okay.
From young
free?
to old, it's free.
I know you said free. Is food going to be part of this?
Food is there. Food is free.
Food is going to be part of this. Yeah, no, count me in. How often do y'all do this, though?
Once a year.
Once a year?
Yes, sir.
When is it coming up this year?
This year is August 17th.
Oh, so that's Saturday. In the next 3 weeks?
Couple weeks,
basically?
Yes.
Oh, wow. What are other expectations? We talked about food. We talked about health screening. We talked about massages. Even after a long day work, I can just come lay down and get massage. And that's free too?
Yes. Well, it depends on the ones that are coming. There are a lot of vendors that are going to be there.
Okay.
But the majority of things are free. There are going to be door prizes. There are going to be giveaways.
Oh, wow. And you're still going to give us stuff too?
Yeah.
I'm loving this already.
Everything. We have the popular Pedro, I think that's how you say it, Pedro 11, Peter, Pedrology. Pedro, well, I say Pedro, but Pedrology Peter, the dance instructor here in Houston, he's going to be there.
Oh, that dude with a full beard. Yeah. Oh, I'm going to burn some calories too. So you're going to feed us and make us burn calories too.
Yes.
Guys, I'm loving your church already, or the ministry already, if I can call that, because y'all pastor, I'll refer to it as a church too. So who are those other than you two? I know you have a lot of behind the scene people. Who are those that are throwing their weights behind this?
The whole weight of Alpha and Omega is behind this. The whole weight of the church, of the ministry is behind this. From all our young people there and all the ministers and pastors there, but also, the vendors that are coming in. We have another vendor by the name of Fifth Udell, very popular.
On Instagram,
yes,
I think my wife follows her.
Oh, yeah, she's going to be present. She's going to have a special appearance there as well. So everybody that's a part of this is throwing their whole full weight behind it.
So do life well. You're not just doing it with the Word of God. You're doing it practically. You're inviting people. You're bringing people on to come and enjoy the goodness of God. To be well in their health, to be well in whatever they consume, to be physically able, and to even legally, you said you have to educate them in the legal ways and all of that, to live right, basically, just generally live. So I need you to be able to tell our teaming viewers again what day this is. I know it's August 17th, what time it's going to be, and where the location will be.
Okay. Well, it's going to be August 17th starting from 12. We're going to start from 12 noon to about 5 p.m. It's going to be at Alpha and Omega International Ministry of Faith. That's at 12835 Alston. That's Alston, Alston Road, Sugar Land, Texas.
In Sugar Land.
Yes,
that's
sir.
not bad. That's central. Although I'll be coming from Cyprus, but it's still worth it because there's free food. Yeah, it's still worth it. Any final message to anybody coming, on safety, the kind of gear they need to wear? You're coming out, I would expect people to wear tennis shoes and stuff, but then, you don't want me coming out with my fila and agbada like a Yoruba angel that I am, and stuff like that. And I'm hoping to get some kind of workout if possible. So any final words for them?
Well, final words, hey, just come out, try to have as much fun as possible. Bring your kids. If you have kids, there are activities for the kids as well. Be comfortable, wear tennis shoes or workout outfits or whatever the case may be, so you can go into the different areas that will be situated there for you, just to have fun. Come with an empty stomach. And,
what is the capacity of this space? I'm asking this because, some of us have 4 children. Some of us have friends, extended families and stuff that may want to come with us, right? So is it on a first come, first served basis, or is just open-ended? Because I know people will be coming and going.
Yes, definitely.
Yeah, so it's open, basically. Mm-hmm. Okay.
It's not a
is it outdoor?
It's outdoor and indoor. It's going to be strategically placed where some, the activities and the bounce houses and things like that will be outside, and there'll be some vendors outside, there'll be some vendors inside. It's just an open area.
Then it's splash pad, like water for the children.
Yeah.
So they need to come with their swimming gears.
Suits.
Awesome.
Yeah.
Well, thank you so much. I am just meeting you guys, and I'm already touched. So you have to lay your anointing hands on me, and so that I can live life well also. I'm already loving it, and I appreciate you guys for doing this for the community.
Thank you for having
Thank you so much.
Thank you.
Well, we look forward to it. Well, you guys stay tuned. There's still more to come.
Welcome to CFAX Global Logistics, where your ultimate satisfaction is our goal. We make your shipping needs a worthwhile experience. As a licensed freight forwarder, CFAX Global Logistics offers air and sea freight, procurement and supply chain, project logistics, warehousing and storage services. Call us at 281-820-9000 or 832-593-3067. We offer prompt, effective, qualitative services, and damage-proof delivery is our guarantee. What's more, we offer the lowest competitive rate for your shipment. You can call us at 281-820-9000 or 832-593-3067. So, to ship your next products and goods across continents on the next available flight or ship at a price that can't be beat, come to our office located at 8180 Southwest Freeway, Houston, Texas 77074 for your shipment and logistic services. CFAX Global Logistics, the trustworthy and reliable partner for your logistic need.
Welcome back to My Community on Afrocentric Television Channel 15.8. As you all know, this is a show that revolves around the Africans in diaspora, where we bring about the culture, the tradition, the businesses that we as Africans are doing in our community that's making Houston the #1 city in the whole world. And by extension, of course, United States. So my name is Kola, and today we're going to be focusing on women's health. A specific aspect of women's health, which is the OBGYN. And, you know, if I say it now, I may just bite my tongue. So I have a doctor here, a specialist, I would call him, to help us shed a whole lot more light on issues facing women, especially when it comes to when they just newly born, and when they get pregnant, when they start their period, all of those things. And I just wish there's another lady here with us, you know, but of course he's been doing this for years, and by the name of Dr. Dama Alexander Ziwaritin. He is the, should I say, the clinical director of Genesys Women OBGYN on Southwest Freeway, and also the medical director and OB hospitalist program at West Houston, Houston Hospital?
Yes.
Yeah, so I need to get these things right, because I need you to tell us about your position at the West Houston Medical Center, and also what prompted you to start Genesys Women.
Okay, well, I was initially trained primarily in Nigeria during my college years. I graduated in 1996, moved to the United States in 2000 after a stint in ophthalmology at the University of Port Harcourt Teaching Hospital in Port Harcourt, Rivers State, Nigeria, and also at the University College Hospital, Ibadan, which is used to be Oyo State. I don't even know what it is
It's
now.
still Oyo State.
So then I moved here in 2000, took the USMLE, which is the licensing examination for medical doctors in the United States. Then started my training in obstetrics and gynecology in New York at Brookdale Hospital Medical Center in Brooklyn, New York. Then moved to Michigan through Michigan State University at Covenant Hospital in Saginaw, Michigan, where I did my last 3 years in training, and was the administrative chief resident in my final year. After that, I have worked in various capacities, first as a pelvic surgery fellow at Southeast Gynecologic Oncology Group in Atlanta, Georgia. From there on to Las Vegas, Nevada, and then now I'm in Houston, Texas.
Doug, you should be board of director global.
I know.
Because we're still going to come back to, because I know you have all these vast experiences in all of these hospitals and running it and doing. Anyway, let me let you go, because I'm enjoying this already.
So finally settled in Houston. I initially worked with Oak Bend Medical Group.
Oak Bend,
2012 through 2016. And then I started my own practice in 2016 December, known as Genesys Women OBGYN, and that Genesys is a GENESYS.SIS. But I coined that name from the Bible, which actually is Genesis,
which is the beginning.
Which is the beginning
of women's health. I love that.
That's how we got that name, and I've been doing that since 2016. And then in February of 2019, which is about a few months ago, I picked up the position of medical director of the OB hospitalist program at Houston Healthcare West, which is the same thing as West Houston Medical Center. So that's what I've been doing. Women's health is my specialty, and our motto for Genesys Women is compassionate care for women. Thank you very much for having me.
Well, welcome. That is such a huge profile. I don't know who's going to fit in that amongst all the people around us, I would say. But anyway, let's dive deep into this. Women's health is so important, right? Why is it important to see an OBGYN for women?
So that's two things. So first of all, preventive care. So medicine in general is preventive care, and then of course diagnosis and treatment of illnesses that occur as we go along. In women's health, preventive care entails screening for basic women's health conditions, breast diseases, cervical cancer screening, and what we call the annual physical examination, which includes also screening for sexually transmitted infections and other basic illnesses that may be ignored. The idea is to catch it when it's early, or prevent it from ever happening. So that's the preventive portion of women's health. And in the diagnosis and treatment portion, we work with women who have gynecological conditions, diseases that would go from simple infections in the vagina all the way through the genitourinary system, uterine fibroids, benign and gynecological malignant tumors, childbearing, so pregnancy, preconceptional counseling, and true antenatal care and delivery. That's the whole focus of preventive and actually diagnostic. And
so that even summarizes the reason why it is important to see an OBGYN.
Correct.
So, as a girl growing up, when is the ideal for them to see a gynecologist for the first time?
Usually female children are taken care of by the pediatrician, just like the boys, up till the age of 13. For between the ages of 13 to 15, we advise that the young girl gets their first gynecological exam. Now, this does not necessarily mean that they're coming in to get checked for most things that we worry about, but it's mainly a counseling visit. So young girls at the age of 13 are teenagers, and they're starting to be exposed to the male counterparts in high school, middle school, high school. So sexually transmitted diseases do occur when they become sexually active. So we teach them on how to have personal hygiene, female personal hygiene, also birth control counseling, prevention of sexually transmitted infections, and things that would affect them growing up.
You know, I never knew this, and thank you for saying that. I thought until, because do pediatricians do this similar stuff?
They are trained to manage diseases and infections that are basically restricted to every other organ in the body, not necessarily the pelvic or the genitourinary, for that age group. So when they do have gynecological conditions, they have to refer them to gynecologists, board-certified gynecologists.
Okay, that explains, because I was like, I failed. You know, because I have a 17-year-old girl who is currently in college, and I felt like I have never taken her to
that visit.
Yeah. So and I don't want to. And I know I'm on top of their health issues. You know. Yes. So and even mine, you know, for a guy, I know they say they twist the arms of men to go do their checkup or whatnot. No, not me. Not me. I schedule it from the first one to the next day. I schedule myself ahead, so I know when it's suitable for me to go.
Sorry to cut it. It's never too late to start. She's 17.
Yeah.
So you still have some time to catch up. But that's a very good age. She understands personal hygiene at this point, but it's good to also get in to see a GYN so she can learn about birth control counseling, STI preventions, which is sexually transmitted infections, and other things that have to do with the female healthcare.
So one of the first things that comes to mind when, you know, as a young girl or as a lady growing up is you've not been sexually active, right? But or maybe you are, but you what is the experience like when or what are they to look out for when they start feeling some kind of pain, like menstrual pain? What are those things to look out for? You know, because I remember my sister trusted me with it. Even all my sisters trusted me with that, because all I had at the time was Panadol. I know it's a pain in the lower part of their stomach, and I was able to tell them this could be menstrual pain because they are of that age already. Right. So what are things, you know, parents should look out for in their young girls?
Well, good. That's a good question. Now, usually girls, when they do get to puberty and they start having their monthly menses, some of them may start having them with pain. So they do get painful cycles, which we refer to as dysmenorrhea, so painful menstrual cycles. There are two broad types of dysmenorrhea or painful menstrual cycles. Number one is primary dysmenorrhea, which is usually mostly familial. So some girls are just born with it. They start having their cycles and they have painful menstrual cycles. We usually would advise at that point they should get their first OBGYN visit to get counseling and education, and also educate them and make sure there's nothing else to worry about. It may just be that it's primary dysmenorrhea, which is of no cause. It's just a natural phenomenon. But we do have some measure of management, which includes pain medications like you mentioned here, Tylenol, some over-the-counter NSAIDs like things like Motrin or ibuprofen would also help to control the pain. Okay. Now, for secondary dysmenorrhea, which is the late type of dysmenorrhea, so some females get to puberty, they start having their periods and they do not have pain.
Pains, yeah.
But down the road, they start having painful menstrual cycles.
Happens?
That is called secondary dysmenorrhea. In those cases, it may be associated with some pathology or abnormality. They definitely need to see a board-certified gynecologist.
So one of the things I know that visiting an OBGYN does is to get checked for pap smear.
Correct.
Right. What is pap smear?
Pap smear is a cervical cancer screening test. So though females are advised to start seeing a gynecologist at the age of 13, pap smears are usually recommended from the age of 21. So 21 years of age. It's a cervical cancer screening test. Females are supposed to have those every 2 to 3 years from the age of 21, depending on the results and the findings of the pap
every
smear.
2 to 3 years.
Depending on the results, yes.
Okay. Does it matter if they've been having sex or if they're a virgin?
If they're virgins, we're not able to collect pap smears, especially if the hymen is intact. So at that point, you're not going to be able to collect the pap smear if the hymen is intact and they're not sexually active. Yeah.
So, take for instance someone that's still a virgin, or even not a virgin, but they're coming for pap smear, but their cycle is not that time of the month yet. Can pap smear trigger that?
Now, my understanding of your question is, when is an ideal time for the woman to have a pap smear? Or if the pap smear can cause pain?
I know it does cause pain. I know it's painful.
It's supposed to be a painless procedure. So ideally it should be painless.
Okay. So but now
a little bit of discomfort but painless.
Discomfort but painless. Okay. My question is about someone that is a virgin or that is not even a virgin, right? But they come to see their gynecology or OBGYN, as you can call it, for a follow-up for a pap smear.
Yeah.
Can that trigger their period to start?
No.
No?
No, the answer to that is no.
Okay.
Periods are cycles. So it may occur every 21 to 45 days, regularly or irregularly, not triggered by a pap smear.
Pap smear. Okay, that's the question. So how many days after a period can a girl or a woman get a pap smear done?
There's no specific time, but it's advised to have a pap smear when she's not on her menses.
Say a week, 2 weeks after.
Doesn't really matter. It's by choice. Just as long as she's not on her menses, it's ideal. Any time after the menstrual period is ideal to get a pap.
Okay, so what does a well woman visit include in medicine?
Good question. Just like the word says well, it is a visit that's not necessarily a visit of complaint. So which means the woman is healthy,
but she just wants
to get her yearly physical and gynecological examination, which includes the pap smear and STI or sexually transmitted infection screen. So she's healthy, but she gets an exam. Same thing with the children. They get a well child exam. It's pretty much the same. Just like even men should have physical exams when they're not sick. So that way you can prevent things
from happening. And if it's about to happen, you can catch it while it's still premature. So what should a girl or a woman or a lady expect on their first visit?
Okay. On their first visit, what we usually would do is to take a history, find out about their previous health status, if they've had any diseases, either gynecological or otherwise, if they've had any deliveries, childbirth, surgeries, if they have any family history of any illnesses that may be of concern. And then after that, we do a full physical examination, which is from head to toe. We do breast examinations, clinical breast examinations, where we try to feel for any masses or any abnormalities in the breast. We do an abdominal exam, chest, listen to their heart and their lungs. We also do an exam of the external genitalia, and then collect the pap smear and testings for sexually transmitted infections.
Awesome. So I have a question. If a woman does since this is happening within the pelvic area of
Yes.
a woman, if she does not know she's pregnant,
Correct.
and she comes in do you do screening for pregnancy? Just because I'm asking this, because though you said it's a discomfort kind of test, but it shouldn't be painful, right? However, if a woman does not know she's pregnant, but she comes in for a visit, for pap smear
Yeah.
visit, checkup, is there a way to find out that she's pregnant or not?
Correct.
During that visit?
In fact, there are cases that women have been diagnosed with being pregnant when they come for their regular annual visits. So in your history, you should be able to elicit that she's missed her periods. And sometimes, maybe out of being so busy and carried away with other things in life, a woman may forget that she had missed her cycle. And when we do find that in the history, we'll go ahead and get a pregnancy test at that point. And if we're unsure, we also do a blood pregnancy test or an ultrasound. So at that point, yes, it could be diagnosed with.
The ultrasound does not affect the pregnancy?
No, it does not.
So, coming to see an OBGYN, how should a woman dress? Because I know a lot of people, they wear tights lately. I don't know why, but maybe they want to showcase their curves or whatever. However, is that even healthy for them?
Actually, there's no dress code to come to the GYN office. So as long as the woman feels comfortable with what they're putting on, or at that point, it doesn't really matter. Because when they do come to see us, we give them comfortable gowns for the procedure, for that visit. So yes, the woman can dress however she feels comfortable. When she gets to the office to see us, we will provide comfortable attire for the exams to do.
So I'm going to ask this from a guy's perspective. Do you advise women to be neatly shaved when they come in to see their OBGYN, or they can just come as they are?
Well, I think that is a personal hygiene question. And
I'm coming from a professional. I would say advice you will have for them.
I think
because a lot of people may not know,
Yes, I think its presentation is usually not a bad thing, but we also don't advise women to specifically shave just to come see a gynecologist. Part of personal hygiene
make them feel uncomfortable.
Make them feel uncomfortable, yes. But we do advise good personal hygiene. Definitely, that's something we encourage.
Can a GYN tell if someone is a virgin?
Well, ideally, if you take that question in broad terms, yes. Virginity, as the word describes it, is the presence of an intact hymen. A hymen is a small, thin layer of tissue or skin that covers the opening of the vagina, or what is called the introitus. It leaves a very tiny opening, almost like a pinhole, to allow for menstruation to take place. Now, that hymen is usually what is broken in the during the process of the first intercourse. Now, but in some women who are athletic, so if they do a lot of sports, gymnastics, that hymen could actually naturally
be broken.
Break without physical intercourse, sexual intercourse. So in broad terms, yes, the presence of a hymen may denote virginity, but the absence of a hymen doesn't necessarily mean that that female has been sexually active.
Since it's still the pelvic area, I want to touch on something that I've seen a lot of on social media: fibroids. Right?
Yes.
It's still down there in the pelvic area.
Yes.
So what causes, I don't know if there's a term for it, but fibroid, I would say, and then how can they prevent it from happening, and or also how can they maintain it through or get a cure for it?
Good. Fibroids is a general lay term for a tumor, a benign tumor, which is non-cancerous, known as leiomyoma of the uterus. A leiomyoma or fibroid of the uterus is a tumor that is made of muscle tissue. The uterus itself is an organ that is filled with muscle. So when this tumor grows inside of the uterus, it is regarded in general as fibroids. Fibroid tumors are benign, which means they're not cancerous, and they occur frequently in women. In fact, data shows that it may be as high as 70% in black women. But in general, Caucasian as well, may be up to 50% of women. It is a huge medical problem of women of color, and may lead to severe anemia, illness, loss of work time and income, and also affecting fertility in 25% of cases. So yes, it is a very common disorder. It's a very common tumor. Now, the etiology or the cause of fibroids is unknown. So no one can tell you how to actually prevent a fibroid from happening. Now, it's good to be able to diagnose them early, and based on the woman's reproductive wishes, treatment or management of fibroids can be done safely, and which may also help in preventing the complications from fibroid, may preventing pregnancy or causing complications during pregnancy and childbirth.
Now we're talking about pregnancy. What kind of surgery can an OBGYN perform on a woman?
There are different surgeries, so surgeries that are related to the women's health. So from minor surgeries, which may just be from a simple office procedure as incision and drainage of a cyst in the vulva or vagina, up to surgeries that may involve cancer of the genitourinary system. So, which, like we talked about, the fibroid surgeries, which is known as a myomectomy, can be done. Cesarean deliveries in cases where the baby is not able to be delivered through the vagina for one or more reasons. Other conditions like may be due to tumors in the ovary, pregnancies that are outside of the uterus, known as ectopic pregnancies. So a wide range of things that could be done. Surgeries related to stress urinary incontinence, when women lose urine when they cough, jump, exercise, or laugh, things like that. We perform surgeries for those. Surgeries that may also be related to dysplasia on the cervix, which is an abnormal precancerous growth on the cervix, can also be performed. So there are a wide range of surgeries, yes.
From the point where a woman notices that she's pregnant to, I need you to just give us a quick summary of the process. Okay. From the point she notices that she's pregnant, what can she do, or what should she be doing? If there be any exercise recommendation. This is just a run through now, right? Exercises, dietary, information you may have for them. When should they start seeing the doctor? And then when they have the baby, how if it's by natural birth or by CS, what are those processes like? Can you just give us a run through and how did you go about it? I know and I can't tell you that I have a lot of questions. I know you have to go back, but to the office. So I need you to please give us a rundown of that process, what it's like, yes, up until when they have a baby and when their baby's first visit should be. Good.
Now, I would say the overview is, before a woman gets pregnant, it would be nice if she could see a board-certified OBGYN. Okay. Because you also have to be prepared for pregnancy. So we do what we call preconceptional counseling. So that way we can teach women on how to have healthy living, healthy diet, exercise to prepare for pregnancy, to make sure they have the right kind of habits, no smoking, no drinking of alcohol, reduced amounts of coffee intake, appropriate exercise, and vitamin intake. So that is the first phase, is really before the pregnancy occurs. And at the point where the woman is now pregnant, or she has had a missed period or two, we usually would advise that the woman goes in to see a doctor if she's missed her period to confirm pregnancy, or at least by the second period she should be getting in to see an OBGYN. Now, from the first visit, we usually would educate as well the woman on the dietary modifications, pregnancy exercises that could be performed in pregnancy, things that they should eat or not to eat, things to avoid. You know, hazards of workplace, you know, like we say, people who work in places where they use x-rays or things. So we advise them on even occupational exposure, like exposure. And then throughout the period of pregnancy, which is 3 trimesters, about 9 to 10 months, 40 weeks you know, specifically, we teach them and educate them on how to care for that.
How often should they see a doctor?
In the first trimester, we usually see women 3 to 4 weeks, and then it goes down to 2 weeks, and then down to every week from 35 weeks until the baby is born. And then after the delivery, we like to see women at least twice within 6 weeks. The first visit, depending on how delivery was done, if it was by vaginal delivery or by C-section, within 2 weeks, and then subsequently at 6 weeks, which is the final postpartum visit. And we also like to counsel women on signs of depression even during pregnancy and after the baby is born.
Signs of depression?
Yes, because of a high amount of undiagnosed postpartum depression.
And also it could be a form of abuse too, maybe you know, emotional abuse, all of those things.
Domestic violence and things
so
like that.
Doctors are not just doctors, they are somewhat the counselors.
Your patient is not isolated just to be the pregnancy. There's a whole lot of things happening around that woman, at home, at work, and so we try to give a kind of global treatment to that lady and management.
Well, I have so much, and I think I still have to have you come back.
Correct.
Please, I mean, our people need to learn. We need to understand the process, you know, of child delivery, childbirth, seeing a doctor, taking care of oneself. That's what we do here at Afrocentric. We give information to our people so they can learn at least what the process is like. But you can't be with this wealth of knowledge, Doc, and not give back to Nigeria, where you came from. What are you doing in regards to that?
Well, in the past, we've carried out many medical missions through small organizations, and even the ANPA, which is the Association of Nigerian Physicians in America, that has organized a lot of medical missions. I've been to a few places in Nigeria on these missions, in Rivers State, Akwa Ibom, and some other states in Nigeria. And at this point, we also do advocacy. In fact, in September, I'm doing a presentation in Rivers State in one of the medical societies called AGIS, Association of Gynecologic Endoscopy Society in Nigeria, which I am actually part of as a member, you know, in diaspora. So we do try to give back as much as we can, even though we have a lot of hectic work schedule here. But as from time to time, we organize trips to Nigeria and give back.
And I think more can be done. I mean, you imagine you're a director, you know, here in the United States. So that means, and you've been to all of these other states that you know, that even a regular businessman would not have been. And you have this wealth of knowledge. You've been doing this for so long, and I learned also you're the first to do certain kind of surgery in this field, right? So, but in Nigeria, we don't have the infrastructure. Is it possible, say, if there's a company or there's an organization or a company or individual, if possible, a private entity that wants to start a clinic or something about women's health, which is your specialty, and invites you to help, is there a possibility for you, and how can you juggle that schedule if you're willing to do that?
Well, we've tried to collaborate with our colleagues in Nigeria, and it's worked sometimes. It's always going to be a work in progress. We have a lot of well-trained physicians in Nigeria. Like you rightly said, the deficiency of technology and that transfer of technology is an area that we're still working on. But I must say, in 2019, Nigeria is poised for that transition.
Beautiful.
We have a lot of young aspiring physicians who are now engaging themselves and acquiring some of this technology. And we also have a lot of individual and groups that have come from other countries. I even hear there's Turkish hospitals, there's Indians that have invested
in Nigeria. Mm-hmm.
So there's a lot of interest in Nigeria and Africa in general, because I mean, when you live here, it's already developed. There's not much you can do. So Nigeria and Africa is the area where.
So, but you're open to it.
Yes, and
you're
we're very
open to it.
doing
very
it.
well.
We are actually involved in doing that at the moment.
Oh, awesome.
Yes.
Well, thank you so much. Before I let you go, I can't but have you, because I believe sometimes people are comfortable in their own skin, right? If you can relate with me better if it's a bar I like to eat. You can tell me if it is not good for me or if it's not. I know you both may not be able to tell me. You know, you can just say starch. You don't understand. That is what I grew up with, you know. But as it affects my health in the United States, we tend to, you know, trust more on Yibo than we trust ourselves. And lately, I see that reversing.
Correct.
I see it reversing, because now you understand that, okay, this person, because he's Nigerian, because he's from Burkina Faso, he can relate with me better because he understood my struggle and he understood where I was coming from when I came in, you know. So tell us, please, how can our people reach your facility?
Good. We're present online, but our office here is on 14825 Southwest Freeway in Sugarland. Zip code is 77478, and it's Genesys Women OBGYN. You can reach us online, www.genesisobgyn.com. We have an Instagram page and a Facebook page as well. And our office number is 832-532-7068. Call in to make an appointment. You can also make appointments online, and we'll give you the best service with compassionate care.
With compassionate care.
Yes.
Well, thank you so much.
Thank you very much.
I appreciate you. And please, we will be reaching out to you to come back and teach us some more.
You're always welcome to do so.
Thank you. Thank you for your time.
Very much.
Appreciate it. Stay tuned. Welcome back to my community on Afrocentric Television Channel 15.8. You already heard that, right? Fawzi said it all, and so did Bayonle. They did spectacularly well. And of course, our guests on the show, wow on those women's health information that we just got from Dr. Zewaritin. He's a friend, and he's been doing, he's an expert in his field. You can tell from the way he's talking, he knows his stuff. Please go see your doctor. You need to get checked out. You need to prevent things from happening. And when you sense that it may be happening, you need to see your doctor to make sure you're doing well, right? And make sure you do the follow-up stuff every time, every year, or every other year, he said. Schedule it. Make sure you get it done. Make sure you get checked. Make sure you are good, right? But the next one, one of our very, very good stuff is these two awesome people. They came to the studio and they offered us for free food. Oh, I'm so going to enjoy it. But anyway, the pastors at the Alpha and Omega International Ministry and Faith, or rather International Ministry of Faith. They are by the name of Pastor Raymond and Pastor Benny. Very young and vibrant, and they want you to live life well. I'm not going to miss it. I will be there. It's going to be on August 17. Its door opens at 12 noon. Be ready, be comfortable in your own skin. Come ready for massage, to eat well, good food, not just African food that's going to get you chubby, or not just American food that is really sugary. Both are just not too good for your health, but minimal consumption is okay. And also, come ready to mingle, come ready to dance, to play, to get wet with the children, and it is just going to be spectacularly beautiful out there that day. Well, until next time, please don't forget to subscribe to our YouTube channel for more. It's Afrocentric Television on YouTube, and on Instagram and Facebook it is at Afrocentric TV. Until next time, stay out of trouble, and I hope to see you again. Take care, Kola.